Welcome to the Workology Podcast, a podcast for the disruptive workplace leader. Join host Jessica Miller-Merrill, founder of Workology.com, as she sits down and gets to the bottom of trends, tools, and case studies for the business leader, HR, and recruiting professional who is tired of the status quo. Now here's Jessica with this episode of Workology.
Welcome to the Workology Podcast, sponsored by WorkMarket, an ADP company. COVID-19 has changed our world in so many ways. We are thinking about remote work, virtual onboarding, work from home policies, work from home accessibility, and also employee benefits. I have seen a ton of resources and information on so many of these topics, except for in the area of how COVID-19 has changed and influenced employee benefit programs. The IRS has published some employer benefit program guidance as of recent, and I wanted to draw our listeners' attention to this because I think that we're so busy, this might have got overlooked. I'm talking with Chad Wilkins, the president of HSA Bank, and he's going to get us up to speed on employee benefit programs post-COVID-19. Chad Wilkins serves as the executive vice president of Webster Bank and president of HSA Bank, where he is responsible for leading the organization and its people towards sustainable growth well into the future. Chad joined HSA Bank in 2014, bringing with him more than 25 years of experience in the banking and health insurance industries. HSA Bank empowers you to make the most of your healthcare dollars by simplifying the health account experience and utilizing cutting-edge technology and innovation to help make sure you and your employees are on their way and on your way to a healthy financial future. Their commitment has propelled HSA Bank to become one of the nation's largest providers of health savings accounts. I'm excited to have Chad from HSA Bank on this Workology Podcast episode. Chad, welcome to the Workology Podcast.
Thank you, Jessica. Good morning.
You obviously have done and have a great deal of experience in the area of not only finance, but also in employee benefits. Can you get our listeners up to speed and maybe walk us through some recent changes in employee benefits?
Absolutely. Yes, there's been a lot going on, as you mentioned, in this area. And I think I mentioned two major changes to start with, and it's related to taxes and changes to health savings accounts. First of all, back in April, the IRS extended the official tax filing deadline for federal tax returns from April 15th to July 15th, 2020, due to the COVID-19 outbreak. Many, but not all states have followed suit to extend their tax filing deadlines as well. But I'd suggest that folks check with either their state or their tax accountant to check on the deadline changes for their own situation. In addition, the tax deadline impacts HSA contributions and as well. So account holders can now make contributions to their HSAs for 2019, up to the new federal tax filing deadline of July 15th. And again, on the state side, we ask that people check with their state agency or their tax advisor. The second thing is HSA, there's been several big changes with HSA usage. First is that in March, the IRS issued a notice that COVID-19 testing and treatment could be covered by HSA-eligible high-deductible health plans before deductibles are met. Additionally, as before, they can get medical testing and treatment, which can be paid by an HSA. The CARES Act was passed, allowing HSAs to use hundreds of over-the-counter products and things like cold and flu medications, and for the first time, menstrual care products without a prescription. So that's a pretty significant change. And then the last thing I'd mention in this area is for HSA qualified plans, they now you can now cover telehealth services before reaching the deductible. Or individuals can go out and purchase telehealth services outside of their high deductible plan without impacting the eligibility of an HSA. So this is a nice change, and it goes through the end of December 31st, 2021, and will be really beneficial, especially in this time as folks find it either difficult to make appointments to go see their doctors or feel uncomfortable going into a healthcare facility during the pandemic.
So that runs through 2021, right?
Correct.
Awesome. I think this is an important area that we should be sharing and communicating with our employees. I know that our listeners, here on the podcast have had a lot on their plate right now, and it's easy to maybe overlook some of these new changes because they can really make it easier for their employees. You mentioned some of the IRS changes, including flexible spending accounts. Can you give us a quick overview, maybe for folks who aren't familiar with FSAs, in terms of what is covered, maybe some amount information, and what things kind of normally stay the same?
Absolutely, and to your earlier point, I think you're right. It's really important to keep up with the changes and to communicate frequently with for employers to communicate with their employees on all these changes. And we have a lot of information on our website at hsabank.com that folks can get the details on if they want to go look things up. But on the FSA side, as many folks know, flexible spending accounts are a tax-advantaged financial account that can be set up through an employer's cafeteria plan. With that, participants set aside funds on a pre-tax basis each year and into the account, and then they can use those funds for qualifying healthcare expenses incurred during the plan year. Folks elect to have the money deducted from their paycheck each pay period, so it's tax deductible. And then they've got some time at the end of the year there's an extension period at the end of the year to plan your payments for about 30 or up to 90 days past the end of the year. There have been several changes that impact FSAs as well, similar to the ones that I mentioned on HSAs. You've got, first, the most important one I'd say is that folks can make changes to significant events such as change a number of it used to be that they could only make changes for dependents, changes marital status, changes in employment and things like that. However, due to COVID-19, the IRS has released guidance allowing for mid-year changes to health insurance elections, plan elections, extensions of grace periods, and so on. So those are pretty important developments. Also, the CARES Act extended to the FSAs as well for the over-the-counter products that I talked about previously on HSAs. And for plans that start in 2019, they extended the deadlines for FSAs, including the use it or lose it extension, the extension and run out period. They also extended appeals period for FSAs. So again, all very important changes that need to be communicated. And then for plans that start in 2020, they increased the maximum rollout or the increase of the FSA rollover maximum from 500 to 550. So those are the key changes that have taken place this year. It is important to note that these are employer managed plans, and the employers need to make the changes to many of the changes I outlined, need to make the changes and then communicate that out to their employees.
I'm so glad you're sharing the guidance on FSAs and the changes from the IRS, because I'm seeing questions in a number of chat groups and social media communities where HR leaders are asking these questions about dependent changes or enrollment date changes. So this is why we wanted to have this particular podcast, because it is so hard to be able to keep it up.
Absolutely. And I'd also say that we've done a few webcasts and also published a lot of materials to FAQs and those types of things to help folks with these kinds of things. Everything I just covered is on our website.
Awesome. Well, we'll also link to HSA Bank resources on these topics. So if you just go to Workology, you'll be able to get access to the direct links to those changes, or you can also go to the HSA Bank website as well. One area that the IRS also mentioned was that health plans may permit employees to apply unused amounts remaining in their FSAs or dependent care programs to pay or reimburse medical care expenses or dependent care expenses. Can you talk a little bit more about this area?
Yes, another significant change, as you mentioned, due to the event, the COVID-19 event, individuals may request changes to their elections specific to dependent care. Employers can also elect a grace period to their dependent care FSA, just like a healthcare FSA. This will allow employees to use their dependent care FSA dollars from the prior plan year in the first 2.5 months of their new plan year. So that's important. And then again, these are employer level selections, and they can't be done by individual employees, but the employer needs to make the plan change and communicate it.
Are you seeing any changes in employers continuing to offer HSA contributions or matches? Because in the 2007 recession, many of these matches were put on hold, as well as other benefits suspended, like education reimbursement. So I wondered what you're seeing right now.
Yeah, so far we aren't seeing any major changes in the contribution levels. I will say that it's early to see. We're still early in the pandemic, so we'll just monitor results as they come. But we are seeing a little bit of a drop in spending, as you might imagine. It's a little tougher for employees or consumers to get to see their physician in these days. People are postponing elective procedures and that type of thing. So, our card spend or account spend is down about 22% over the last few weeks of March compared to March of 2019. So I think we're also seeing an increase. We have a website, HSA Bank store, and that's an online ability to purchase goods online, and we're seeing an increase of about 45% on online purchases. So there are some changes in terms of spending dynamics. I think some of that's going to come back as we go through the year and things start to open up and people can get in and do their elective surgeries and things like that, which would be good because, I think making sure that people stay healthy through the pandemic in other ways is really important.
I appreciate the insights here because I feel like so many of us were in the middle of the pandemic and we might also be thinking about open enrollment programs and looking at the end of this year into next year in terms of changes or revisions. And we're kind of working in a situation that is changing day by day. It's always interesting to see, in my opinion, what things or what trends that you're seeing in terms of changes and in comparison to the recession of 2007.
Yeah, thank you. And the flip side of it is we are seeing an increase in terms of how much people have saved in their HSA accounts because there's still the contributions, as I said, are coming in, but we're not seeing the distributions going out. Because as you know, the HSA is also a retirement vehicle. It's not just a spending vehicle. So I think it's important that people continue to save through this period if they have the ability to do so, as healthcare costs continue to go up in retirement.
Let's take a reset. This is Jessica Miller-Merrill, and you are listening to the Workology podcast, sponsored by WorkMarket, an ADP company, about employee benefit changes due to COVID-19 with Chad Wilkins from HSA Bank.
You have a handle on your W-2 employees, but what about all of those 1099 contractors? With WorkMarket, your company gains visibility into your extended workforce. Learn more at workmarket.com.
I want to shift gears a little bit. With so many people being furloughed and layoffs that also might be on the horizon for many of our podcast listeners, is there a best practice that you're seeing to communicate to employees about all these changes that are happening? What are you advising your customers and clients right now?
We have done about 150% more communications out to our members and our employers over the last several months. And so I think communication is really important right now because of so many changes happening out there. We also have, helped our employers with regard to, many of the things that we have laid out. They can pretty much take and customize slightly and then issue out to their employees. The other thing we caution is take some time and think about, make sure if you're contemplating any plan changes, you don't need to react immediately. That make sure you review everything that's going on and all the changes, and then most importantly, make sure that we're extending out some of the benefits that have been offered through all the legislative changes, right, and the IRS changes. Those are things you can just kind of roll forward and just communicate and make sure that you support, especially all the, I think it's really important for people to be able to make election changes. So if you saved in your FSA and for healthcare and you've got dependent care or commuter benefits changes, I think it's important to make sure that you're helping people make the changes to accommodate their specific situations. And, I'd also encourage employers continue to contribute through the period if they can. Even many folks that get furloughed are still on their health plans and are incurring medical expenses or may incur medical expenses in the future. So continuing to support those contributions through the pandemic, we urge that as well. So again, every situation is different for each employer and for their employee base, but I think it's hopefully this will not go on forever, right? And the sooner we get through it, the better. And I think we'll all come out stronger on the other side.
Are there any other suggestions or ways that you feel like we should be supporting employees during this uncertain time when it comes to employee benefits and programs? You mentioned the telehealth, which I think is fantastic, but any other areas that you feel like HR leaders should be thinking about?
Yeah, I think the one you mentioned is really important. Telehealth is great. Many employers offer telehealth programs, and if not, they can partner with a telehealth provider pretty quickly and give support in that way. I think the thing that we really help and try to help employers with is, this is such a complicated area, and trying to simplify it and help people make decisions on things like selecting the right health plan, making contributions to their health plan, how things work in conjunction with between a 401k and an HSA, limited purpose FSA. So, many times you get to the benefits period and people get online and you got to make choices. And so we're trying to help employers put the right kind of tools in place so individuals have some guidance on and help them make those right choices, because benefit selection can be really tough. The other is navigating the healthcare system. Again, it can be complex. So as folks are out, especially when people are working from home and may have a little bit more time to access or look for cost and quality in their healthcare. So tools that allow them to have some transparency into a high quality, lower cost providers or services. And last but not least is that retirement plan, right? So making sure you understand how the HSA fits into that mix, and that you understand how much healthcare is going to cost in retirement, and that you're making the right kind of moves to prepare for healthcare and retirement. So we've got tools and calculators and resources that can help people with those kinds of decisions as well. This is a good time to focus on that type of thing as we go through the rest of the year and then prepare for enrollment season coming up in fall. At least that's when we get the bulk of our enrollments come in the October timeframe.
Especially with so many employees working from home right now and probably doing that for the foreseeable future, I think it's really important to have those resources available online and accessible for employees from their homes to go over the plans and information with their families too. I think it's a challenge. A lot of us were in offices, or a large percentage of our workforces were working in offices with intranets and portals and things like that. The world is very different right now.
It absolutely is. And there are so many tools and resources. And, our focus continues to be an HSA is an account to put the savings in and to, pay for healthcare and then to save. But it's really all of the things you talked about is making sure that people make the right decisions in the right places to reduce the cost and make sure that you can afford healthcare for the long haul, and that you're staying healthy at the end of the day.
So many of us in HR are looking at employee benefits programs for the next year, or maybe reassessing their strategy. What things are you seeing right now shifting? What's different?
Yeah, I think some of the things that I mentioned earlier, Jessica, the telehealth services is a big change that employers can now go out and incorporate that into an HSA plan and offer it alongside of an HSA plan. So I think it's a good time to look at that, particularly again with folks working from home and some uncertainty as to accessibility to healthcare services as we go into the next year. I think also that many of the things I mentioned earlier is you're planning now is probably a really good time to think about, as I head towards enrollment. A lot of times we don't start educating people on enrollment until they're actually logging on to the system and ready to make their decisions. And one of the things we've started off in HSA Bank is to encourage employers to send out communications ahead of time we have this thing called the 30, 60, 90 campaign that we send out after somebody enrolls in a plan, so to make decisions at the right times along the way. And we've recently started implementing a 90, 60, 30 campaign, where 90 days ahead of enrollment, you start to communicate with employees and get them ready for enrollment well before they get to the point where they're at the deadline. Because I don't know about you, Jessica, but my typical MO is to log on the around 11 p.m. when the deadline ends at midnight, right? In October. So, the sooner we can get to folks and help them get ready for that moment, the better. And I think looking at plan design and, when people talk about high deductible health plans, a lot of times they think that, that scares them. And I'm going to look at a traditional PPO type plan because I don't want to, quote high deductible plan, but plan design is really important. And, so we encourage making matches of contributions, because when you do, individuals, they kind of get encouraged to save more. You can also tie them to taking your health plan or health assessments and doing, contributing to healthy behaviors and so on. So plan design is really important. And if you do it right, many times, we find that when you have a choice of two health plans, an individual is much better off financially making the choice to go into a high deductible plan versus a traditional plan, because of things like employer matching contributions, the tax implications of an HSA contribution. Really, you're getting a discount on every dollar you spend to go to the doctor. You're getting a discount in terms of the tax implications. So, it's important to consider all of that. And when people pay more attention to, when it's their dollars going out or theirs and the match from the employer, they pay a lot more attention to the cost and quality question, which lowers overall healthcare costs. And the other thing is, employers have to think about the tax deductibility themselves of making contributions, because, that actually comes back, because you're encouraging employees to contribute, and you can lower the cost of your own healthcare costs while actually lowering them for the employee and creating a more effective plan, essentially. So those are the kind of things we're out working with our employers and our prospective employers on as we head into the rest of the year.
I love your perspective on this, because it is such a challenge to communicate to employees how these high deductible benefits plans can be beneficial and actually a cost savings, because you only see the $5,000 or the $10,000 deductible and you're like, oh my gosh, I don't have that in my savings account right now. But there are a lot of other ways, like the FSA and the HSA, like you were talking about, that can really help employees bridge that gap and maybe save them some money year over year.
Yeah, and it's interesting when you mentioned the actual deductibles. The gap is really narrowing between HSA qualified deductibles and traditional deductibles. And then, so when you start to apply the premium deltas and the tax implications, in many times you're going to find that it's a more effective plan for people.
That's where the calculators come into play and are so helpful in telling the story.
Exactly. Yeah.
Well, Chad, thank you so much for taking the time to talk to us on the podcast today. Where can people go to learn more about HSA Bank and the work that you guys are doing to help employers with financial benefit programs?
Yes, thank you, Jessica. They can come to hsabank.com, and what we talked about before, all the communications, there's a link out there for special communications, but they can, all of our tools and the resources that we talked about are out there on our public website, and also all the contact information for individuals. If they want to talk with us directly, they can reach out that way.
The pandemic has brought about so many changes for HR, including these employee benefit programs and the changes outlined by the IRS, not to mention these dependent changes in terms of selection. We need to be talking to our employees about these and also educating HR teams and our leadership teams who field employee questions on these subjects every single day. One good thing coming out of this crazy time is the rise of telehealth and a move towards virtual benefit plan selection and onboarding. I remember the days of monthly or weekly benefit plan meetings for new employees and hours spent in location break rooms fielding employee questions prior to that annual enrollment deadline. These changes, going more virtual and online, give everyone more flexibility, not to mention the ability to better scale in HR how we engage, share resources, and support our employees. Thank you for joining the Workology podcast, sponsored by Work Market, an ADP company. This podcast is for the disruptive workplace leader in HR who's tired of the status quo. This is Jessica Miller-Merrill. Until next time, visit workology.com to listen to all our previous podcast episodes.